go to all patients, and I'm going to choose admit, and I'm going to say 3rd floor. And this is live in order to make this video be beneficial. So I have cut off you can do active orders last 7 days. You can click on the detail. So if, let's say I wanted to see the detail of this Foley Care, I could click on the detail of the order, and it would tell me more about what was going on with the order. I can sort them by type. I can only see certain types if that's what I want. I can reset it. Again, I can save it using the oval button. So this just gives you a good view of the diet orders and then the non-pharmacy orders that are on the patient. You can sort them here by type, etc. I think is a little easier. And if you wanted to save that and that be your default, then of course you would click on Save. Under the Results tab, you have 4 sub-tabs. You have Radiology, Lab, Radiology, Image, Cardiology, and Other. I guess that's actually 5. We don't have anything under the other, so or under Cardiology at this point. The Cardiology stuff will come back under Radiology. So under Lab, you can see you have new ones. When you've reviewed them, that new will go away. You can see that you have a result indicator here that shows you that you have a normal result, or this in case is an abnormal result. A critical result will be a red C. Those to see the result itself, you can click on here. If you wish to see all of these, select them all and click on the print button, and you should have a print preview, and you're able to look down through all of them without necessarily having to open up each one. So for this particular patient, you can see we have a BMP, we have a CMP, a couple CBCs. So if I opened up this and I wanted to open a CBC up, maybe I wanted to trend the RBCs, I can trend it. I can see that this was the 17th, this was the 18th. And if I wanted to put any of these values in my documentation, I would simply depress them by clicking on them. And then when I went to my documentation, went to that free text under Lab, and then clicked on the clipboard, these values would then drop into my document. So that, and then we click back and back. And as you can see, even though I am not the physician attending here, this lets me know that they're new, that once the attending physician reviews them, then that will take that new off. Radiology, we can come in here, we can see the image. We can click on this to see the report. In this case, they usually will do the print and do the copy-paste to put it in their document. That's really the only way to get it in the document. If the patient had MRI or had a MUGA, cardiovascular studies, etc., they should all show up in here as well as a result. The radiology image tab is just basically the same as the radiology tab. And our cardiology stuff comes back in the radiology tab because it all comes from our PACS system. Under the medication view, this shows you all the meds that the patient is on. If you want to say, I want to see the last 24 hours, click on the detail button. Excuse me, I need to click on the check box and then click on the detail button. I would see the last 24 hours. I would see that the patient was given the tablet, who gave it, if it was not given, why it was not given. I would see, the information on the meds for the last 24 hours. The physicians find this view to be extremely helpful. I can also click on a specific med. I can see the start date, the start time. I can see who ordered it. Vital signs. Under the vital signs, vital signs and measurements. So you have your vital signs here, your patient vital signs, your measurements, if this person is getting any calf circumferences, etc., your I&Os. I do want to point out that the net I&O admission is inaccurate. If you are interested in the net I&O since admission, you need to speak to nursing. I think they're hand calculating it. It is not correct right now in Paragon. They know about it. It is a work item and they're working on fixing it. If the patient's on a ventilator, the event information will show up here as well. Under the clinical assessment tabs, you have several things that you can see. You can come down here and again set your favorites to what it may be. There's the discharge assessments, there's the daily nursing assessments, pre-procedure assessment, checklist, pain assessment, progress note. Nursing does usually admission, daily, and discharge are the common ones. There's wound assessments. It just depends on the patient and which ones you're looking for. Under the patient scheduler tab, if the patient was scheduled for surgery or procedure through central resource scheduling, it would show up here and show you what they're scheduled for and when. The reports tab allows you to run reports on the patients. The physicians might be interested in an ED summary report, or they might be interested in a patient profile report. Both of these reports take a little while to launch, so I'm not going to go into them. I think the patient profile report would have things like family history, med history, home meds, recreational drug stuff, height, weight, all those types of things. The caregiver schedule is basically, it just allows you to see your schedule. So if you're a surgeon and you have surgery scheduled and resource scheduling, you would be able to see them here. And that would be all patients. You'd be able to see what your schedule looks like. Covering, we do not use the covering system in Paragon. Essentially, the docs sign out. They just sign out verbally to each other, and they just look up the patients in the list. The miscellaneous tab allows you to look up a physician's office number, not their cell phone number. So if I wanted to look up, Dr. Robles' office number, I would choose Robles, and I cannot see that his office number is here if I needed to talk to him. And finally, the URL tab allows you to go out to other websites on the web. So we have some dragging custom commands, how to do those, basic commands, have the CDC, XComp is a drug reference, the ORB, which is going away, and then the ORS, the automated reporting system. We are working on getting ORS integrated into Paragon so that the physicians don't have to sign on over and over again.